Now we're going to assess the spinoglenoid notch at the posterior aspect of the shoulder, but also the suprascapular nerve in the suprascapular notch, where we will carry out a suprascapular nerve block. To find the spinoglenoid notch, if you just palpate the posterior superior aspect of the acromion, pop the middle of the probe just underneath that area that you palpate, and you can see on the ultrasound the humerus, you can see the labrum, that small triangle, you can also see the glenoid. If we slide across medially, you can then see the spinoglenoid notch. Now, people do have different shaped notches, so quite often you just have to move the medial side of the probe slightly superiorly to optimize the image. Now, do be careful. If you ask your patient to laterally rotate, you will often see a small vessel come up, which is not to be mixed up with a cyst. And come back. So just be aware that that is normal anatomy and not to be confused with pathology. If you come back, to find the suprascapular nerve, which can be quite tricky to find, and again, there is a lot of variation. The way I find it is to find the acromioclavicular joint, and you can see on the medial side, you can see part of the clavicle. Now, if we slide off, you can see the end of the clavicle and you can see a cliff face. As soon as you see that, if you bring the probe back and round, you should be able to pick up the joint, which we can see there, and again, the superior aspect of the labrum. All we then need to do is to slide the probe again medially to look for the shape of the bone. Now, quite often, again, you do need to just rotate the probe up, or in this case down, so you can see a nice image of the suprascapular nerve within the suprascapular notch. And that would be our target for a suprascapular nerve block injection. That's all right, isn't it?